Hi there, my name is Victoria and I'll be your nursing student today. I'm here to give you your spironolactone. Before I do that, I just want to give you a little information so that you're well informed before you take your medication. To begin, can I just have you verify your name and date of birth for me? Perfect. And then any medication allergies I need to be aware of? No? Great. So like I said, today I'll be giving you spironolactone, also known as aldactone, which is a potassium-sparing diuretic. It's used in patients with heart failure, liver cirrhosis, and hypertension to prevent fluid accumulation in the body, leading to swelling in places like the arms, legs, hands, feet, and abdomen. This medication acts as what's called an aldosterone inhibitor, which is just a fancy way of saying that it prevents the body from holding on to sodium and water and allows the kidneys to get rid of it from the body. Typically, potassium would also be expelled in this process, but with this medication, it causes the body to hold on to that potassium, hence the name potassium-sparing diuretic. So it's good for individuals who are at risk for hypokalemia or low potassium levels. This medication is also good for people with heart failure as it's cardioprotective, which just means it essentially reduces the strain on the heart caused by too much fluid in the body. Because this medication causes the reabsorption of potassium, you are at risk for developing higher than normal levels of potassium, also known as hyperkalemia, especially if your kidneys aren't functioning well or if you also take ACE inhibitors or ARBs. As with any other diuretic, there are a few important things to know before you take this medication. It is important to monitor your weight daily for any large fluctuations and to let a healthcare provider know if there are any large changes in that. It's also important to make sure that you're monitoring the amount of fluid that goes into your body to make sure a similar amount comes out, to make sure you're not retaining any water that you shouldn't be. We'll be monitoring your electrolyte levels to make sure that as the fluid gets expelled from your body, your electrolyte levels don't become out of balance, as that can be dangerous. And because this medication affects your overall fluid levels, it can affect your blood pressure and pulse rate. The overall goal of this medication is to lower both of those, but I'll make sure to come back and recheck these after you take this medication to make sure they don't drop too low. As these lower your blood pressure and heart rate, it can make you a little dizzy and can cause rapid drops in blood pressure, especially when you sit up or stand up. So if you have to change positions, do so very slowly. And if you need to get out of bed to go to the bathroom, which you will, please let us know using your call light so that we can help you. The changes in your electrolytes might have you feeling weak or tired, but this is relatively normal. But again, please let us know if you need to get up so we can prevent you from falling. With less fluid in your body, it can lead to some constipation, so it's recommended that you take a psyllium-based bulk-forming laxative, also known as Metamucil, to prevent any issues with that. Otherwise, are there any other questions I can answer for you? No? Great. Well, here's your medication, and like I said, I'll be back in about an hour to recheck your heart rate and blood pressure, but in the meantime, if there's anything else you need from us, please let us know.